Sorry, a phone call breaks up these videos. Feel the pulse of the brachial artery is what I was saying. In the medial antecubital fossa. Okay, you can feel a pulse inside the arm of the brachial artery, and you can feel pulses in many areas of your body if you know where to look. So back down to the forearm, there's the medial, ulnar, and the lateral radial arteries. Okay, these converge to form a superficial and a deep palmar arch, okay, or palmar arcade. These are superficial and deep arch-shaped arteries that are supplied on one side of the arch from the ulnar and the other side from the radial, and they converge and send out branches to the fingers, the digital arteries. So the digits are fingers, and the digital arteries are the blood supply to the fingers. Okay. Let's kind of scoot this up and look at the abdomen. The diaphragm separates the abdominal from the pelvic cavities, and there's a defect in the diaphragm, a natural, healthy, normal defect or hole called a hiatus, where the aorta passes through and dives into the abdomen before it bifurcates down in the pelvis. So this area here is known as the abdominal aorta. There are a number of important branches. The most proximal branch is known as the celiac trunk, or sometimes called the celiac axis, same difference. It's celiac, and it's got 1, 2, 3 branches. My mnemonic is come, have, some large grits. That's common hepatic. Common hepatic. Left gastric. I know this is hard to read. And splenic. Okay. There are 2 renal arteries, left and right. Okay. Those supply the kidneys. There's, of course, a large liver in the right upper quadrant. That's where the common hepatic travels. And then there's a spleen in the left upper quadrant. The next branch distally is called the SMA. That's superior mesenteric artery. And distal to that, the IMA. That's the inferior mesenteric artery. Yeah. SMA and IMA, very common abbreviations. Okay. Their territory we'll talk a bit more about in the digestive system, but they supply the large and small intestine and a couple other things. So obviously really important arteries. Yeah. The aorta bifurcates. It splits into 2. It branches like a fork in the road into right and left. These vessels are called iliac, just like the iliac hip bones of the pelvis. And the sacrum back there. Okay. These are called the iliac vessels, and they branch into internal and external. These internal iliac, internal iliac, these things supply the pelvis, the bladder, the rectum, the uterus, many muscles and nerves in that region. And then the other branch is the external branch. External iliac comes down and it crosses a border. There is a ligament that stretches from the anterior superior iliac spine to the pubic tubercle, the pubic bone. It's known as the inguinal ligament, and distal to that inguinal ligament, this vessel becomes known as the femoral artery. Okay, inguinal ligament will be green. Inguinal ligament. Okay, there's a right and a left inguinal ligament. And distal to that, the vessel becomes known as the femoral. And the femoral ultimately is going to split into a posterior and an anterior. But before it does, it gives off a deep branch to the quadriceps and hamstrings and the femur called profunda. Okay, profunda means deep. When it reaches the knee joint, the name changes to popliteal for a short segment behind the knee. And then this vessel branches into two sural branches, an anterior and a posterior tibial arteries. Okay. These come down and meet up and form arches in the foot, the dorsal and plantar arches of the foot, just like in the hand. Posterior tibial, I should have labeled these differently. The posterior tibial artery ends up more medial, and you can feel its pulse behind the posterior to the medial malleolus of the tibia. And the anterior tibial artery, of course, is in the anterior or dorsal aspect of the foot, and you can feel the pulse on the dorsal aspect of the ankle, and at that level, the artery is known as DP, dorsalis pedis artery. Okay. All of these arteries that I just named have companion veins by the same name: popliteal vein, femoral vein, internal iliac vein, external iliac vein, common iliac vein. Okay. If I were to draw them, things would get, really hairy, but they course up along with the arteries. Okay, and they form the big boy, big blue, the inferior vena cava. Okay, and down here, same thing. Coming out from down here, internal iliac vein, common iliac vein. Okay, and there's a big IVC with a bifurcation just like the aorta. Okay, and these travel alongside each other. There's definitely more to the story of the venous drainage of the intestine that we'll get to. There's something called the portal vein in the portal system that's a little different, but we'll get to it. Okay. Remember that in addition to the deep veins of the leg, the veins that share the name with the arteries, there is a superficial system of veins in both upper and lower extremities. There are superficial veins of the legs known as the saphenous veins, S-A-P-H-E-N-O-U-S. The saphenous veins, great and small. Great saphenous vein, small saphenous vein. Okay. I'm going to show you their path in class because it's easier to show you in a 3D model the course of these, but they're definitely superficial. Clinically, they behave different. Blood clots in these vessels have very different clinical implications than blood clots in the deep veins. So they're treated differently, they're affected differently, they're treated surgically different. The small and great saphenous veins can be sacrificed and removed from the leg to be used as graft material elsewhere if you need a conduit for a bypass. Okay. So that's the superficial veins of the leg, great and small, saphenous. If we come up and look at the upper extremity, okay, there are veins that travel along with these arteries just the same. Okay, there's a radial vein, an ulnar vein. These coalesce to form a brachial, axillary, and ultimately a subclavian vein. Okay. Excuse me. There's a subclavian vein on, on the right as well. And these two big vessels, the subclavian veins, the brachiocephalic veins. Hold please. Let me take a step back. I'm sorry, I'm confusing and I skipped something because we haven't talked about the head and the neck yet. But the subclavian veins come in from the extremities. They join with the jugular veins from the neck, and together, those two, jugular plus subclavian, make the brachiocephalic veins. Okay. Jugular plus subclavian make the brachiocephalic veins. And when the brachiocephalic veins on the right and the left join up, they form the SVC, the superior vena cava, that drains into the right atrium. Okay. Let's look at the head and neck real quick and help. Oh, first, let's do the superficial veins of the arm. Arm has superficial veins as well. There's a lateral cephalic and a medial basilic. Okay. These form from some superficial forearm veins, and there are a couple of different layouts of forearm superficial veins, but they coalesce to form these cephalic and basilic veins. And I want to show you in a diagram how those two join up with the deep system, and I will show you that in class. So this guy has an aortic arch from his heart. Obviously, none of this is really drawn to scale or properly. And remember that the first branch off the aortic arch is the large brachiocephalic artery. Okay? There's only one brachiocephalic artery, but remember that there were two brachiocephalic veins. So two brachiocephalic veins, one right and one left, unite to form the SVC. This is the the brachiocephalic artery, of which there is only one. Sorry, I ate a granola bar and I'm having some of it in my lungs apparently. The brachiocephalic artery branches, and it sends a subclavian artery down to the right upper extremity, and it sends a right common carotid artery up the neck. The next branch of the aortic arch is the left common carotid artery. So this is the right common carotid. This is the left common carotid. Each of these branch to form a right and left external that supplies the face, the cheeks, the scalp, stuff like that. The throat, the pharynx, and then there is an internal branch that supplies the brain. So here's the brain with the right and left half, and there's an internal carotid artery that supplies the brain on the right and left side. Okay? Remember that on your list you'll see a vessel called the vertebral artery. Off the aortic arch, there's a brachiocephalic artery that becomes a subclavian. And this early branch of the subclavian artery is known as the TCT, the thyrocervical trunk. Thyro means thyroid, it goes to the thyroid gland. Cervical means neck. This gives off a branch to the backside of the brain known as the vertebral artery. If you remember the transverse foramen and the cervical vertebra, those accommodate the vertebral artery. It travels through those foramen on the way up to the posterior brain. Okay, so off the subclavian artery on each side, there's a thyrocervical trunk that has a thyroid branch and a vertebral artery. The vertebral artery travels up through the transverse foramen into the posterior brain. Okay, so this is the arterial supply to the head and neck in a real nutshell. The brain is drained by veins just like everything else. Okay, and the veins that drain the brain are known as the IJ veins. That's internal jugular. Okay, and the veins that drain the scalp and the cheeks and the neck and the throat, those are known as the external jugular veins. Okay, these two form a common vein that unites with the, they form a common vein that unites with the subclavian vein on each side. Subclavian plus jugular equals brachiocephalic vein. Subclavian vein plus jugular equals brachiocephalic vein. And the right brachiocephalic vein and left brachiocephalic vein converge and coalesce to form the common SVC that dumps into the right atrium. Okay, so that's the venous drainage of the head. Sorry. Of the head and neck. Again, it's a nutshell, and I know it may not be easy to see everything I've written and drawn, but I'm demonstrating how you can walk through this and draw it and explain it as you go. And if you guys can do this, what I just did, and explain it, then you're going to do fine on the tests. Okay, you have to be able to be comfortable enough with this material to do what I just did. Okay, and if you know that, then you can answer blank lab exam questions about this stuff. And you can answer questions about it that I ask you verbally. Like I could ask you a question like, what two vessels blend or coalesce or converge to form the brachiocephalic vein? The answer is jugular vein, subclavian vein. So answer A is going to be subclavian and jugular. Answer B is going to be axillary and jugular. Answer C is going to be SVC and IVC. Answer D is right, and it's going to be like a question like that. You could answer it by labeling a diagram, or I could ask you it in words. It's all the same material asked in a different way. I could ask you, what are the three branches off the aortic arch? And I could ask, and the correct answer would be brachiocephalic, left common carotid, left subclavian. But the incorrect answer choices would be brachiocephalic, right common carotid, left axillary, right? There's like so many combinations of things that I could put on there that are wrong. But the only right answer is brachiocephalic artery, left common carotid artery, left subclavian artery, right? And if you can draw this diagram and explain it and teach it, then you can answer that question on a multiple choice exam with no problem. Okay? There's many, many ways I could ask questions about this. But it's all rooted in the layout and the names. And if you can draw this diagram, then you can answer whatever questions about it. and you have a list to go off of. If you go back to the skeletal unit, you'll notice that I did not ask you about lumbrical muscles, interspinalis muscles, the extraocular muscles, the medial and lateral rectus, the inferior and superior oblique muscles of the eye. I didn't ask you about that stuff. I asked you about the stuff that was on the list, right? So I'm not going to say, where does the superior pancreaticoduodenal artery come from? And maybe you learned that in your studies because you're interested in it. Maybe I know that as a former general surgery resident, but that's not on our list. It's not going to be on the test. But to ask you the 3 branches of the celiac trunk, absolutely. And there's 3 answers to that. There's 3 answers to that. It's come, have some large grits. Common hepatic, splenic, left gastric. And I put that as an answer choice, and the other choices are going to sound right. They're going to be other arteries in that area. It's going to have right gastric, it's going to have right hepatic artery, it's going to have pancreatic artery, it's going to have stuff I make up. You know, it's going to have basilic artery, it's going to have, you know, also, I could ask things 1,000 ways. So that's why I'm going to recommend that you learn to recreate this type of diagram that includes everything on your list. And when I give you an assignment to make up test questions, that's what I'm asking you to do. I don't want you to give me questions about the superior and inferior pancreaticoduodenal arteries and the minuscule blood supply to the rectum and the portal vein and all this stuff that we haven't talked about. That's not the purpose of it. But if you take a look at this material and say, like, how could he ask me a question about that? That's the purpose of it. That's what will help prepare you for the exam. Let me just look at this list and make sure there's nothing else I forgot to mention. There probably is. Oh, the gonadal vessels. So whether it's the ovaries or the testicles, their arteries come directly off the abdominal aorta. So this is the abdominal aorta, and there's a right and a left testicular artery. There's a right and a left ovarian artery. Depends on if we're talking about a male or a female. They're collectively called the gonadal arteries because gonads are the organs that make sex cells. So the testicles are the male gonads and the ovaries are the female gonads. So those things could be referred to as gonadal arteries. What it means is also testicular arteries or ovarian arteries, same difference. They come straight off the abdominal aorta. And they travel down to the testis or the ovary. The veins that drain those organs are different from each side. The left gonadal vein goes to the left renal vein. The left renal vein. The right testicle, the right ovary, the right testicular vein or the right ovarian vein drains into the inferior vena cava. It drains straight into the IVC. Oops, hold on. The IVC. So the left testicular vein drains to the left renal vein. The left renal vein joins IVC. The right testicular vein drains directly into the IVC. The right testicular vein does not drain into the right renal vein and then to the IVC. So that's a difference. That's an exception. Okay. IVC, SMV, portal vein we'll come back to. Splenic vein travels with the splenic artery. It has a different destination. It does not go to the IVC. We'll talk about that though. I'm not going to test you on the stuff we haven't talked about. Lower extremity, common internal fetus, great and small savinous,
And you'll notice that we haven't covered yet the blood supply to the brain. I think what it's going to end up being is extra credit. If you get everything else down and you want some extra credit, then you could learn the blood supply to the brain, and we'll have some extra credit questions about that. But I would not worry about extra credit. First I would worry about the meat and potatoes of this. This is the hardest part of third unit, sorry.